Hi, a very important point of discussion, lipid profile or lipid panel. Once in our lifetimes or many a times we have been advising our patients to get their lipid panel or lipid profile. The lipid profile is a blood test used to measure the components of lipids in the blood which are notoriously responsible for future cardiovascular diseases. Notably, total cholesterol, low density lipoprotein cholesterol or LDL, high density lipoprotein cholesterol or HDL, TGs or triglycerides, and there are some other lipid profile components which are not usually measured by this simple lipid panel test. The first confusion that used to arise is that many a times we have been told by our laboratory guys to get at least a 12-hour fasting sample to obtain your lipid profile. Now, this was a myth. The recent guidelines clearly mention that the first sample to give for lipid profile should be a non-fasting sample, meaning thereby the non-fasting sample can clearly show the exact level of total cholesterol as well as LDL cholesterol and HDL cholesterol. The only parameter which is fasting dependent is triglycerides. So a lipid panel, first non-fasting sample. If that is abnormal, then you may ask your patient go for a repeat lipid profile when fasting, at least 12 to 14 hours fasting to look for triglycerides. So if we look at the lipid profile per se, the individual components, the most important component that being a cardiologist we are concerned is LDL or low density lipoprotein, because LDL is the number one cause of future atherosclerotic plaque in a patient with heart disease. So LDL is responsible and is known as hypolipidemia or hypolipidemic cholesterol, which is responsible for most of the deaths of cardiovascular diseases. People who have got high LDL cholesterol, they are more prone to have future condition like cardiovascular acute coronary syndrome, like non-STEMI, unstable angina or myocardial infarction. So the lower the LDL, the better. The most nadir of LDL is not established. We have data which clearly shows the importance of very low LDL with very good prognostic significance as far as cardiovascular diseases are concerned. Next is HDL or high density lipoprotein. HDL are the protective cholesterol components. The higher the HDL, the lower the chances of having coronary syndrome or heart attacks. However, there is a paradox after 60 mg%. If the HDL is more than 60 mg%, then the risk is paradoxically elevated in those patients as well. So we need to keep the HDLs between 40 and 50 mg%. In females, it is categorically seen in the Asian population where I belong to, or South Asian population, that females, they have heart attacks when their LDL are high while the HDL is absolutely normal. While in male counterparts, majority of the heart attacks occur with a low HDL and a borderline or elevated LDL. So if these two components have been taken care of, the third component is triglycerides. The triglycerides, they are the hardcore lipids in the blood which act as ESR, or acute inflammatory marker. So triglycerides, if they are elevated, if they are more than 400 mg%, they are directly causal agents to cause acute pancreatitis. So in the past, when the triglyceride used to be more than 400 mg%, the therapies were started to lower down the triglyceride levels in order to prevent pancreatitis. However, recent data has clearly shown that raised triglycerides are independent risk factors for coronary artery disease. So if the LDL has been taken care of, the HDL has been taken care of, and if there is hypertriglyceridemias, they are an indicator of management. So we treat raised triglycerides if the LDL and HDL has been taken care of. So this is the basic component of lipid profile which we advise our patients. The AHA, ACC guidelines clearly document that the first time the lipid panel should be advised is at 9 years old. If that is normal, then we jump on to 20 years old. And if then it's normal at 25 years old and then 30 years old. But if the report results are abnormal, then we give that to attending physician when to repeat the test. So I think that is all about lipid profile. If you like my discussion, please click the bell icon and watch out for my next subsequent videos for different cardiovascular parameters.